CES coverage sponsored by GoDaddy.com, the leader in domain names, web hosting services. New customers save 25% by using promo code CES25 at GoDaddy.com.
The CES coverage is sponsored by Luxor, Las Vegas. Get to the point. Rooms start at $40. You can go over to tpn.tv for the Luxor advertisement, which is the gateway to savings.
CES coverage sponsored by Audible.com, where books come alive. Listen to a bestseller on your iPod or MP3 and get a free trial at audiblepodcast.com/CES.
All right, we've got Chris Bergstrom here, who is the Chief Strategy and Commercial Development Officer, and Anand Iyer from it's the CEO of a company called Welldoc. Welldoc, how you guys doing?
Good. How are you?
Good. Good to see you guys.
Good to see you. Tell us a little bit about Welldoc.
So we're a technology-enabled.
Why don't you move your microphone up just a touch? Yeah. Let's turn that up. There we go.
Are you good?
There we go.
Very good.
So Welldoc is a technology-enabled healthcare company that helps patients who suffer from chronic diseases, diabetes, asthma, congestive heart failure, use their cell phones and web technology to actually deliver to them clinically relevant and behaviorally driven coaching that helps keep them where they should be with respect to their medication adherence, with respect to the things they're supposed to do to manage all of their wellness, all the things that you think about eating and exercise, and really helping them to optimize their outcomes. The company itself, an interesting foundation in that the idea came from an endocrinologist who was frustrated with her patients and herself really, in that patients would come in, say, 3-4 times a year for a 5-minute office visit, and it was like teaching a foreign language in that short period of time, kind of garbage in, garbage out. There's only so much the doctor can do in a 5-minute visit, and of course, your blood sugar is never as good as the day you see your doctor, right? It's like flossing the day before you see your dentist. And the aha moment was that everybody who came in, regardless of their socioeconomic status, regardless of their age, regardless of their amount of level of education, everybody had a cell phone. And they weren't afraid to use it. Hold on, Doc, I need to take this call. So we did 3 things. We said if we can put software on a phone, and it could be a BlackBerry, it could be an old J2ME phone, it could be an iPhone, let them use the devices they want. So if you could put software on the phone that coached them and gave them the bite-sized chunks they needed. B, if you stood back and could you watch all of the trends. Now, why is it that Chris woke up for the 3rd time in a, say, 1 week period and hasn't recorded any carbs with his medication? And it looks for the patterns and it pushes education to the... And then the last thing is, could you take all that information and could you analyze it against evidence-based medicine and suggest to the doctor as a support note, hey, here's where they were, here's where they are, here's what's changed, here's what you might want to discuss with them, but you're the expert, do what you want to do. And when we did our clinical trials with that kind of 3-pronged approach, the outcomes, 2.8 A1C reduction in diabetes, huge cost savings per patient on an annual basis, FDA clearance now, partnerships with the likes of people like AT&T Enterprise who are taking this and helping us scale to take this to large health plans, and so you get a sense of what we're at.
Well, they always say if you live healthier, you don't have to use the, you don't have to go to the doctor, well, you have to go to the doctor, but you don't have to go to the doctor for the wrong reasons.
Right. I mean,
and
it's amazing. We have, if you just take diabetes, for example, and it's true of many chronic diseases, we have excellent physicians, we have excellent drugs, we have excellent devices, yet in diabetes, 63% of the people are not meeting the target guidelines as the American Diabetes Association recommends. So clearly something's missing. And, I think a small analogy might be if you're driving your car down the road and maybe your GPS says, oh, red line, we're coming up on a traffic jam. Well, it's nice to know, but it would be awesome if your car said, here's what you need to do about it. You need to take a right, take a left, get off, and get back on, and you'll be good to go. In diabetes today, patients are dealing with a situation like that where they're really getting a data point that's okay, that's nice to know, but what do I do with it? What do I do with that glucose value? What do I do with the way I feel right now? And so that's where Welldoc comes in to fill that gap and say, let me help you, coach you through that. And we're not trying to practice medicine, we're just trying to help the patient adhere to their own physician's guidelines. So being founded by doctors, it's something very important at Welldoc is that the patient and the provider are very much engaged together.
Okay.
So what is the mechanics of what would the patient do? Let's say they have a cell phone, and so what is the interaction between the patient and the phone and the doctor? Can you describe that?
Sure. So the patient gets a download to their phone, and this download has an electronic logbook for them. And that's where they actually make their entries. In the case of diabetes, it's things like their medications, their blood glucose levels, kind of how they're feeling, responses to surveys. In the case of other diseases, it's other metabolic parameters. And what they get is they get both real-time feedback. So, for example, I'm a type 2 diabetes patient myself, and I use our product. And, sometimes in the morning I haven't had my snack, and so my blood sugar dips low, and I feel kind of low. And what a lot of patients tend to do when they're low is they overcorrect. So I remember when I was diagnosed, I'm supposed to eat, 15 grams of carbohydrates, rapid-acting carbs, and I would eat a chocolate bar. And 5 minutes later, I'd still kind of feel like this. I'd eat another chocolate bar. So I would swing throughout the day. And my doctor sees an average, so he thinks I'm doing okay.
So does the patient actually enter that into the
They
phone?
enter it into the phone.
So when they do their blood test, then they go ahead and enter that number.
And you can think of technology as a great enablement here. So if the blood glucose meter is, say, Bluetooth or some wireless protocol that beams the data into a Bluetooth-enabled phone, great. If not, lowest common denominator, they type it in, and then they're away to the races.
Okay, and then so the doctor gets that information, or how?
Good question.
Does he subscribe to that service and has to?
Very good question. So the patient invites, and they can invite multiple doctors. So you think about one of the biggest problems today is care coordination. Patients have to coordinate with their primary care doctor, their cardiologist, their rheumatologist, their, all this. So the patient invites these people, and then they participate how they choose to participate. Some people, for example, will set the parameter to say, show me a weekly report, or show me a monthly report, or show me a 3-month report. Some people say, you know what, hey, I don't have any electronic medical records. Can you just send me a fax the day before the patient comes in to see me? So it's really configurable and customizable to the way the patient and the physician want to manage that relationship.
Yeah. I mean, it's important. The physician is only involved as much as they want to be. We're only there to help them. We're not there to push 5,000 data points at them, but we just want to give them an expert consult whenever they want it. So it might say, here's where your patient was, here's where they are today, now here's what's changed. Now according to the standards of care, you can see the gap in what's occurring. Now you're the doctor, you make the decision as what you might want to do about it. But for the patient, we have an epidemic in most chronic diseases that's skyrocketing around the globe. Yet the providers, obviously are not increasing at the same rate, and in many cases, they're actually coming through medical school with almost less providers available for this increasing population, especially with the baby boomers coming on board. And so the big gap in care is, well, I might see my doctor 4 times a year, but what about the other 361 days a year?
Right.
And how do I stay in tune? And so the system actually coaches them in real time with an automated expert system. So it's not dependent upon a clinician in a back room somewhere on a phone call. It can work very well in that kind of environment as a supplement, but the system actually coaches them in real time automatically.
And just to build on what Chris said is, the way I manage my diabetes may be different than somebody else who has diabetes. We may be similar in terms of our ethnic background, in terms of our diet, etc., but how the drugs work in my body and what my medical history is and what my comorbid conditions. Do I only have diabetes? Do I have diabetes and hypertension? When the patient registers on the system, they put in this information, and in fact what they get on their phone is personalized for them, not just for content, but for tone. We have patients who tell us, if you give me one more way to go John message, I'm going to throw the bloody phone away. And other patients are like, listen, if I have a good day, can I have a picture of my grandchildren come up at the end of the day that says, this is what keeps me going?
And I think it's important to talk about the economics because chronic diseases represent over 80% of the cost in healthcare. And I think everyone knows that healthcare is breaking the bank in our country and around the world. And a lot of the healthcare in the United States is paid for by employers. And so what's interesting, one of our first partners and customers is AT&T, who's a Fortune 10 employer. They have over 1.3 million lives under benefits, including their retirees. And what AT&T has said is, look, we'd like to roll out Welldoc solutions across our employee population because we really think it can make a difference, make them healthier, make them better workers, lower our healthcare costs. But then, they went even further and said, we think this is so good, we would like to sell it as a healthcare vertical. So now they are a sales and marketing arm for us in all the enterprise channels. So they're going to the other large employers and saying, look, we think it's good enough for us, we'd like to introduce you to Welldoc as well.
Wow.
So
That's a lot. That's a lot of information.
It is.
So good. and so can you this is a program that you could get. You don't need to have a doctor monitor it, right?
It's a very good question. We had in our one of the paths Welldoc has taken is to do a series of clinical trials, and we did the clinical trials because we wanted to show how this worked, but we wanted to do it and show how it worked in different healthcare models. So, for example, could you give it to just a patient and see if the patient alone improves with the virtual coaching? Mm-hmm. Could you then maybe have the next level up that says, I'm going to now share the raw data with the doctor, but I'm not going to give him any of the expert analysis, because some docs are like, you know what, just show me a dashboard, I'll figure the rest out. And that's what I went to med school for, and that's kind of what I'd like to do. And some docs are like, listen, they're coming in with a bump, a rash, a scratch, an itch, H1N1, and then you got 10 seconds to say, hey, how are you doing on your blood sugar? It would be really nice if your little expert system could tell me, hey, talk to them about their LDL cholesterol, talk to them about, things to improve their dietary control and carbs at lunch, blah, blah, blah. So what we find is that it's valuable for patients, but as you start to include more and more and you start to bring the patient-physician relationship closer, we've seen better outcomes.
So a lot of this can be patient-driven, but also can be, I guess, doctor-driven, where a doctor would recommend to a patient?
It's in fact, Chris, why don't you talk a little about whole reimbursement and what that means?
Right. I mean, when we went through the FDA process, we actually established FDA clearance for this product, and we got a clearance for both a prescription version and an over-the-counter version. And it allows both consumers to kind of initiate it, or a nurse educator to initiate it, or a physician to initiate it. And we think that there's several business models out there. One of them, as I mentioned, is in the enterprise market, where the employers are really saying, look, I'm willing to pay for this for my employee population because it makes sense. But I think also in the broader marketplace, as drugs and devices are reimbursed, we're working with the payers and with Medicare and Medicaid to be reimbursed as a product to deliver real value.
So I guess that was my last question, was the cost. What does the service cost?
Yeah, I think in most cases it'll be similar to a drug, where there's a copay for the patient, and then the rest is covered by your insurance plan. And we're rolling it out initially through the employer market, and every employer will set it up however they really want to in terms of what visibility the patient has to the cost. But then I think 2012 is really where we'll make it more broadly available through the typical channels.
All right. And I think just maybe one additional point to what Chris said is the market's looking at this as a something that's truly driving outcomes. So in diabetes, this number of A1C, which is the primary metric of diabetes wellness, it's the amount of sugar in your blood. It should be 7% or lower as a target. Every 1 point delta, 7 to 8, 8 to 9, is a 42% increase in the risk of heart attacks, blindness, stroke, kidney failure, amputations. We got a 2-point reduction in our clinical trials. Now, just to put that into perspective, a drug is considered a blockbuster drug if it gets a 0.5 point reduction. That reduction can be anywhere between $1,500 per patient per year savings, as high as $8,000, $9,000, $10,000 for the higher acuity patients. So they're coming to us and saying, guys, this has demonstrated significant cost savings. Now put a bundling thing together. It's got to have, if the patient doesn't have a phone that supports a data plan, the app, and that's kind of where we're headed.
Full solution.
Yeah.
Right. Well, it sounds great.
All right. Where do they go to get more information?
They can go to welldoc.com. Is our website, www.welldlc.com.
Right. Chris?
Sounds great.
No? Thank you very much
Thanks,
for your time.
Thank you.
Right.
Appreciate it.
Great.
Thanks for having us.
Brian. Great.
Enjoy the show.
All right. Thanks. You too.